Hello and Assalamu alaikum. Ultrascan Diagnostics. Here, this is the CBCT of the patient that you had requested. The area of interest is the top, the maxillary posteriors, the mandibular posteriors on the right side, the maxillary posteriors and the mandibular posteriors on the left hand side. Starting with the maxillary upper right second premolar, first premolar region. This is the first premolar. This is a grossly carious tooth. We've got a peri-apical infection and a periradicular infection, quite severe. Very thin buccal cortical plate is left as a consequence of this infection, but just in case, this is extracted 10 millimeters of width and 15 millimeters of height. The first 6 millimeters is going to be just granulation tissue, and then we'll have the two quality bone. This is the region of the five region. We've got 7 millimeters of ridge width, 14 millimeters of height. This is the region of the 6. We've got a periapical radiolucency in the mesial root. Interradicularly, we can see we've got an approximate ridge width of 12 millimeters and a height of 7 millimeters. So that is how we can see. And this is the region of the 7. We've got 9 millimeters of ridge width with 7 millimeters of height. Moving to the lower right region, this is the lower right 5 region. We've got this tooth will need to be extracted because of its mesial inclination. D2 quality bone, 6 millimeters of ridge width with 13 millimeters of height. Moving to, once this tooth is extracted in the region of the 6 and 7, we've got an approximate 9 millimeters of ridge width with 10 millimeters of height. Moving towards the posterior, upper left posterior, if the 6 is in fact extracted, we've got a ridge width of 13 and a height of 5 millimeters. We cannot do a sinus lift until the sinusitis is cleared. So the left maxillary sinus is filled with sinusitis, and we've got a periapical radiolucency present here at the parietal root as well. Moving to the lower left region of the 4, we've got D2 quality bone here as well. 7 millimeters of ridge width with 13 millimeters of height. In the region of the 5, we've got very radiodense bone, 4 millimeters of ridge width with 8 millimeters of height. And then in the region of the 6, we've got again very dense bone, 7 millimeters of ridge width with only 10 millimeters of height.